Today's presentation, like you mentioned earlier, it is on supported housing from the Foundational Community Support Team from the Washington State Healthcare Authority. The agenda for today will be, will be focused on foundational community supports, brought to you by Kimberly Castle and Anessa Williams will be our presenters for today. There will be an opportunity for questions and answers at the end of the presentation. If during the presentation questions come up, you guys can type them into the chat box, and we will keep an eye in the chat box for any questions, and we can bring those up during the Q&A. And then after the Q&A, we will conclude our meeting. So at this time, I will stop sharing my screen and I will let Kimberly and Anessa start their presentation.
Hi, everybody. Hold on just a second. I will screen share here so you can all see the presentation. All right, can we all see that?
Yes.
Awesome. All right, my name is Anessa Williams. I'm the Supportive Housing Program Manager serving mostly Eastern Washington. I have a background in FCS supportive housing case management as well, and I have also worked with Spokane's Area Agency on Aging, been with the Healthcare Authority since August, so it's a pretty new role for me. Kimberly, you want to go ahead and introduce yourself too?
Sure. Hi, everyone. My name is Kimberly Castle. I am the Foundational Community Supports Quality and Alignment Analyst here at the Healthcare Authority. Been with the FCS program since implementation and was actually in the role Anessa's in now as the Supportive Housing Trainer for Western Washington for about 5 years before I moved into this role. Background in supportive housing and homeless outreach, and really excited to be sharing this time with you today to talk about FCS. Back to you, Anessa.
All right, we also have, just to point out some other folks on our team, we have a supported employment program manager in Eastern Washington as well. That's Dawn Miller. And on the west side, we've got our supportive housing and supported employment folks, Jackie and Darren. And then we've also got our FCS program administrator, Scott. And Maureen is on the call right now too. Maureen's our new TAP program manager. And then our other FCS program manager, Rayanne. Any of these folks you can go with to questions. We're all happy to answer anything you might be wondering about. Okay, so first we're going to talk a little bit about social determinants of health or health-related social needs. Those are the conditions in which people live in that are going to shape their health, including things like socioeconomic status, support networks, neighborhood and the physical environment that you live in, access to healthcare and nutritious food, things like that. FCS came about because there was a recognition of the need to provide assistance to folks who have barriers like disabilities and chronic homelessness and mental health issues and things like that, recognizing that those health-related social needs are a very important aspect of somebody's health. The evidence-based practice that FCS supportive housing is based on is the SAMHSA PSH principles, which we're going to talk about more a little bit later in the presentation. Basically, though, there was a recognition that it's not enough to just help somebody find a place to live. We need to help them build the skills to maintain it as well. That's really the biggest part of the battle, I would say. Really taking that whole person approach and wrapping around somebody to provide a whole team of folks to work with them around any kinds of issues that they might have with maintaining housing. There are some other programs as well, Porch, Bridges, HARPS. These were some programs that kind of set a precedent for FCS. We have a really helpful subsidy matrix that kind of breaks down what all of the different subsidies are, who is eligible for them, and what kinds of things they can be used for. Kimberly, do you want to speak to any of that anymore?
I just wanted to, the programs that are up on here are all of those pilot projects that kind of led us to get to FCS. That's actually what built the white paper for the waiver. And So if you want to have some really late night reading to help you sleep, there are some really great links in here to see kind of and learn about the history of supportive housing and supported employment in Washington State. We've actually been doing this for a little over a decade now to get to where we are. And so we're really excited. I have to say, I started in the Porch program in 2011 when it first started. And that's kind of what launched me into housing. And truly, the idea that we have Medicaid now paying for supportive housing, and now we're working to get even rental assistance soon through Medicaid. This is like a dream that we didn't expect to be able to like accomplish in such a short period of time. Even though 12 years is 12 years, it's really rapid for the kind of work and progress we've made here in the state. So I just want to say that it's exciting that you guys are able to frontier this work across the country, and a lot of states are kind of following suit. So it's
Thank you.
exciting. Yeah.
Okay, getting into FCS, and I apologize if any of this is information that you heard when my employment colleagues did their presentation, but just in case anybody missed that one, FCS has been going on for about 5 years now. Launched in 2018. I guess that's 6 years. 6 years now. There's over 200 providers in Washington, over 26,000 people enrolled. It's on a 5-year renewable waiver, and it just renewed most recently back in June, which brought some really cool changes with it, including the age for supportive housing eligibility is 16 instead of 18, which is very cool because agencies can now start helping youth in that transitional period. And there were some other cool changes with that as well. Anybody on the HCA FCS team will have this provider map linked below our email signature. If you're ever curious about, what's available in whatever county you might be looking at, it breaks it down by who does housing, who does employment, and who does both. It's very cool. Okay, so what FCS is targeted Medicaid benefits that'll help clients with complex health needs maintain their housing or employment. Provide those supportive housing services, and we'll talk more about what specifically is a supportive housing service in that pre-tenancy and maintaining tenancy stage. But it's not any kind of ongoing rental payment. We have other resources for that we can also talk about, not wage enhancements. It's not an entitlement. Qualifying factors for supportive housing. They need to be on Medicaid. Most types of Medicaid are eligible. They need to be 16 and up to receive services, and they need to meet one of the medical necessities that affects ability to live independently or function successfully, and also at least one of the risk factors for supportive housing. So the medical necessities here, you need to meet at least one. Mental health need, where there is a need for improvement, stabilization, or prevention of deterioration due to resulting from the presence of a mental illness. Substance use disorder, diagnosed by meeting, according to the American Society of Addiction Medicine criteria. They need to have a need for assistance with 3 or more ADLs.
Hi, Cindy. I have an appointment scheduled for next Thursday for a
they need to be a homeless individual with a disability as determined by a coordinated entry assessment. Any questions about any of that? All right, we'll move along to risk factors then. So the risk factors, again, they need to meet at least one of these. One of them could be chronic homelessness, which means they're homeless for at least 12 consecutive months or on 4 separate occasions in the last 3 years that equal 12 months. This definition can also include individuals who previously met the HUD definition of chronic homelessness, but have been housed in the last 60 days, as long as their amount of time housed isn't more than 60 days. Frequent or lengthy institutional contacts, so things like being in and out of corrections, skilled nursing, inpatient, psychiatric, anything like that. If they are a frequent flyer in any of those facilities, that could qualify them. Frequent stays in an adult residential care facility, frequent turnover of in-home caregivers, or a PRISM score of 1.5 or above. And PRISM, in case anybody doesn't know, is how much somebody is utilizing medical, social service, behavioral health, emergency services, things like that. Okay, so the rates for reimbursement for supportive housing, it is a per diem rate. This is actually something else that just got changed with the waiver renewal. It used to be a 6-month authorization period, but now it's a year authorization period. And I am not 100% sure what that looks like. It used to look like they had 30 days of service in a 6-month period. Kimberly, do we know yet what that's going to look like with the year period?
Yeah, so we haven't quite gotten to the 12-month authorization. That is going to happen this year, though, and it will probably be double the units. So currently it's 6 months with 30 units for that 6-month authorization. More than likely, as we move into the 12-month authorization, that'll probably be doubled to that 60 unit for somebody across that. But we're still working on protocol for that. So just stay tuned, and we'll keep you all posted as those things move ahead.
Thank you.
That aligns with, just so you're all aware, if you haven't heard of our program, Apple Health and Homes, that we're partnering with Commerce, that's going to happen with the launch of Apple Health and Homes as part of the legislation. So stay tuned.
And the reimbursement rate is $112 a day. It being a per diem, that means that whether you spend 15 minutes with somebody or 3 hours with somebody, you're still going to get that $112 reimbursement. Services can be reauthorized as long as somebody continues to need the services. There have been folks that have been enrolled in FCS since it launched in 2018 and are still utilizing FCS, and that's fine because they still need the services. There's also something called an exception to the rule, which is an authorization process. If somebody is using more than their 30 days of service in a 6-month period, you can put in an exception to the rule, which is basically a request for additional units supported by, their case notes and what has been done to support them, what other services are they utilizing, just a request for additional units, basically. Okay, so these are some things that are billable supportive housing services before somebody is housed. Any kind of conducting assessments, any kind of care coordination with other partner agencies or other local providers that they may be involved with, development of community supports, which can, look like helping folks access a food bank or a faith community or, anything to help them get immersed in the community that they're hoping to live in. Any kind of treatment planning, helping them establish short-term and long-term goals and breaking that down into manageable steps. Any kind of advocacy, especially with landlords. A lot of times folks that qualify for FCS might be a little bit difficult to house for a variety of reasons, whether that's a spotty rental history or bad credit score or, possible justice involvement. So it's really important to be able to advocate for them as to why they should be able to be housed and what kind of supports your program can provide to ensure that they stay housed. Financial skill building, helping folks budget, especially, you move into a place, you need furniture and you want a TV and all of these things. How can we set aside some money every month so that we can get those things? Stuff like that. And any kind of benefits support. So if folks need help getting set up with food stamps or managing their SSI, anything like that, all of those are billable pre-tenancy services because any of those things is going to help somebody find and maintain their housing, and that is the overall goal. You can tie most things back to helping somebody maintain their housing. And then, of course, once somebody is housed, there's still lots of work to be done. Care coordination, again, will always be a billable service. If they are interested in getting back to school or getting involved with working or something to that effect, you can help them with that. Informal community support development, and that can look like anything from like, hey, how do we meet people in our neighborhood? Or, let's walk around and see what you might be interested in doing in this neighborhood, things like that. Helping people develop independent living skills. This is a really important one. There's a lot of folks that are getting housed for the first time in maybe 10, 15, 20 years. They might lack some of the independent living skills, like, how do we keep our apartment clean? How do we store food? How do we wash our laundry in an apartment? All things like that might not be skills that somebody has, so they might need some work on that. Again, advocacy, we see a lot of issues with folks maybe not getting along with their neighbors or having difficulty communicating with their landlord or anything like that. Being able to work with them and help them advocate for themselves in a positive way is a great skill to work on. Treatment planning, helping folks increase their ADLs, benefits management, and again, landlord liaising always. That's always a big one.
Nessa, can I hop in for a second?
Yes, please do.
Okay, just one thing I want to always try to remind folks is that FCS is so it is a Medicaid program, but we do allow for certain services that can be billed that aren't face-to-face. And I like to mention that because, as you know, if you're familiar with Medicaid, services are required to be a face-to-face through Medicaid. So we do have a couple things that you can bill for under FCS that we consider collateral services. So when we're talking about that coordination of care on behalf of an individual with outside partners, we do a lot of that work in housing. You can actually bill for the time that you're coordinating care on behalf of somebody as long as it's related to the housing work that you're doing. Same with if you are coordinating with a landlord. We know that there's lots of times when we're talking to a landlord where the individual isn't next to us. You come in on a Monday morning, 9:05, Joe's landlord calls and is like, okay, we have problems. Joe had a wild, weekend at his house and we need to deal with this. You spend 45 minutes on the phone with Joe's landlord with him not next to you. We want you to be able to bill for that time and just document what happened and why Joe wasn't next to you, right? But we want to make sure you understand that you can bill for those collateral services, as a lot of work in housing and employment happens on behalf of folks. So just wanted to mention that as well.
Yeah, that's a great point. Thank you. Okay, so we're going to get into the principles of supportive housing. There are 7 of them. We will talk more about each of them individually, but the 7 are choice of housing, separation of housing and services, decent, safe, and affordable housing, integration into the community, rights of tenancy, access to housing, and flexible and voluntary services. So when we talk about fidelity to the PSH principles, we're referring to the fact that evidence-based practices lead to better outcomes for people, right? It's been shown that when programs operate based on these principles, folks get housed, they stay housed longer, they're happier with their housing. And we want those outcomes to be standardized, right? So that if somebody is receiving housing services in Washington, they could be receiving the same quality of services as somebody in Florida if they're using FCS. Preserving the components that made the original practice effective can directly impact the success of the desired outcomes. And there is lots of data and lots of research that shows like this stuff really works. So the first principle is access to housing. And this refers to any kind of readiness criteria. So we like to see a program say that there is no kind of readiness criteria other than somebody, shows up, walks in, whatever, and says, I would like to start looking for housing. Great, let's start looking, let's talk about it. Some programs implement readiness criteria like, somebody has to be participating in housing case management services, or somebody has to be clean and sober before they'll house them. Things like that. And of course, programs like that have their place, and some folks will opt to work with programs that operate like that. But Perfect Fidelity says like, all you have to do is say you want to look for housing and we will help you look for housing. Of course, also, we like to see people with barriers to housing being prioritized. And if you're operating on FCS, people with barriers are being prioritized. Unit entry too, we don't want, ideally, your housing folks will not be able to, your housing case management folks or anybody in that kind of role will not just be able to walk into your apartment, right? We'll talk about that more in the rights to tenancy principle, but once somebody gets their apartment or their house or whatever, it should be their place. They have the right to let you in or not. It's as much theirs as anybody else's home is theirs. We also like to see programs actively soliciting new participants, especially, you know, doing outreach at homeless camps, doing street outreach, really actively trying to get people into the program who have those barriers. And that can also look like coordinating with other agencies and, you know, kind of sharing referrals, things like that. The next principle is choice of housing. And this can look like quite a few different things. That might mean, you know, the type of housing as far as, do they want to live in clean and sober? Do they want to live in an apartment? Do they want to live in a tiny house? Do they want to try to buy a home? All of those kinds of things. Or if, you know, say you're taking somebody to look in an apartment complex, if there's 3 different open units, are they getting to look at every single open unit? Another thing we really like to see is somebody should be able to say no to a place without any kind of repercussion from the housing program that they're working with. Because of course, you know, if you kind of say it's this or it's nothing, they might take it, but they might also not be very happy with it for a variety of reasons. You know, there's lots of different reasons that folks are going to have preferences about where they live, whether that's because it's close to their job, it's close to their kid's school. Maybe they need a first floor unit for disability purposes, things like that. There's so many different factors that can make an apartment inappropriate for somebody. So we don't want anybody to be forced to live somewhere that's not going to be a good fit for them, because likely they're going to become homeless again because they won't be very invested in it, or it won't work for them. And choice of living arrangements is important too, of course. You know, do they get to choose if they have a roommate? If they need to live with, you know, their caregiver or their kids or somebody like that, are they able to make that happen? We have a good analogy here for soda. Say somebody offered you a Sprite or a Coke and you picked one of those, but then you realize, oh, there was actually, you know, there was Fanta, there was grape soda, there were all of these other options I could have chosen from too. You probably wouldn't be too happy that you only got shown 2 options out of the several hundred. This can be kind of a tricky principle in areas where there's just not a lot of housing available, and that's a lot of areas right now. It's really hard to find units that are in the right price range, and sometimes there's just not enough physical housing, but there are still ways to honor somebody's choice and respect somebody's choice, and just make sure that the person that you are trying to house has a voice in what kind of place they're hoping to live in. Okay, the next principle is rights of tenancy. So the biggest thing, of course, is there a lease in their name? They should have legal rights to their apartment that anybody would have to their place. We also want to make sure the lease doesn't have anything weird in it that wouldn't be found in a standard lease. And of course, again, this depends on the kind of program that it is. Some programs are going to have, you know, things like drug testing or mandated services or things like that. But SAMHSA PSH Fidelity says it should just be a regular lease with no extra rules or stipulations in there. And also, of course, if they're working with a housing program and say the participant says, you know what, I don't want housing case management anymore, or, you know, I don't want to do counseling or whatever it is anymore, that shouldn't affect their housing at all. It should just be like, okay, well, here's your apartment. Call me if you need anything, but we're not going to force you to participate in services contingent on you getting to keep your place.
Can I jump in? I just wanted
Yes.
to add to that, that we, you know, like Inessa mentioned in choice, we want to honor a participant's choice. And so their choice might be recovery housing or Oxford. And we know those places don't have legal leases in the same way that our permanent supportive housing will, or our, you know, scattered site housing will. We still want to honor that, and we still want to make sure that we're thinking about what they need. So just helping them understand that they are going into a place that doesn't have a traditional lease. They may not have the same rights to tenancy, and explaining to them what they're going into and what their accountability is, as well as the landlord or the house manager or whoever that might be. And so for Fidelity, if we were looking at making sure everyone had a lease in their name, I would ask to have, you know, those rules in their file and have them sign it so that we know, so they have something to go back to and refer to if something comes up around their housing. So we still want to honor those places. We know folks need different kinds of support and housing, but also it's just helping them understand what that looks like if they're going into a place that's not traditionally like a legal lease.
Yes, yeah, we want them to be able to make an educated choice and fully understand the impacts of whatever decision they're going to make. But of course, yeah, it's their choice. And that might be the best fit for them. Okay, the next principle, or sorry, not the next principle, just a note on landlord liaising and engagement. It's really important as a housing specialist to kind of get to know your local housing community, network with landlords. This is so, so important, and it can be kind of tricky to do. I've talked to a lot of housing specialists that, obviously you're very busy in your job, just working on housing people and managing crises and things like that. Or if you're not super familiar with the community that you're working in, that can be tricky too. But it's so helpful to be able to have some landlord contacts and be able to, really market your program, speak to why your program is able to support clients in a different way, how clients are able to be successful with the supports that you're providing, and really just get to know kind of as best you can, kind of match participants with landlords, because you'll know certain landlords are going to crack down on certain behaviors more than others, or certain landlords really have a soft spot for helping the population or whatever it is. It's just really helpful to get to know some local landlords, and then you can kind of lean on them. I heard a fantastic success story in a Fidelity review last week where the housing case manager was looking for an ADA unit. Those are obviously few and far between, really hard to find. But a landlord that she had had a previous relationship with called and was like, hey, I have this ADA unit. Do you know somebody that might need it? And it's just opportunities like that wouldn't come together if you didn't have some kind of relationship with the landlord. So it can be very, very helpful, especially with sort of tricky situations like that. Okay, so decent, safe, and affordable housing. They should be able to, units that people are being housed in should be able to pass HHS and HQS inspections. And of course, we like to see a record of that in people's files, or at least that the inspections are being done. They don't necessarily have to pass. If somebody chooses to live somewhere that's not passing inspection, again, that's their choice. People should be ideally not paying more than 30% of their income for rent. Again, though, if somebody opts to live somewhere that's a little bit more expensive and that's just, that's what works for them, that's fine too. But ideally, we like to see no more than 30%. Don't want to see anybody paying so much of their income towards rent that they're not able to afford anything else. And ideally, folks are being housed all over the place. It's not just, oh, here's a cheap unit downtown, and all of the folks are being housed in that same area. We really love for housing specialists to be looking all over the place. And again, that reflects client choice too. When if somebody says, I'd rather live in this neighborhood, or I want to look over here in this more rural community, that they have that choice.
One of the things I like to mention also in the affordability piece is this is really where FCS pairing the supported employment and supportive housing can come into play and really work well together. Not only because employment is, going to help them long-term maintain rent and be able to pay for that, but also that we know that when somebody gets a job, a lot of times that's where they build their informal supports in their community. I tell people that like 90% of my friends came from different jobs in my life. And so it gives them purpose and want to be part of that community, which we'll talk about in integration. But really thinking about why employment and housing can work so well together, so that folks really do have a way to maintain long-term rent, because we know that a lot of the benefits like SSI, SSDI still keep folks in poverty, right? And we want folks to be able to move above, through that and be able to really live self-sufficient. So just wanted to add that.
Yes, employment services and housing services really do pair so well together. I could talk about that for hours. That could be its whole own presentation. Okay, so talking about just finding housing, where do we find it? Another collateral service is, this is one that a lot of providers aren't aware of. If, say, you are supposed to be meeting with a client and they no-show, what you can then do is go and do an in-person, in-car search, drive around looking for billboards, drive around looking for rent signs. As long as you are able to, write down all the contact info, the addresses, and specifically tie the units you were looking at back to a specific participant, that is a billable service. And it can be a great way to find units that might not be posted online on, apartments.com or other websites like that, because some of the smaller landlords will only do little billboards or yard signs or things like that, and are often able to be a little bit more flexible than a large property management company. So it's definitely an option to consider. Of course, also do look online though. Lots of folks get successfully housed that way. I don't want to knock that option either. Utilize any kind of community resource. If there's any kind of like landlord coalition or group like that, that would be a great resource to tap into. And when talking to landlords, always try to come with success stories, really build up your program. If you've got like an after hours, like on-call phone or something like that, a crisis line, landlords love to hear about that, because that means, if your person is in their apartment having a big party on Saturday night and it's getting loud and out of hand, they can call somebody and they can, have kind of a mediator come over and take care of that. That could really help. And of course, always honor choice, always provide options. A lot of folks are okay with being unhoused for a little bit longer if it means they're going to get a place that they're more satisfied with. So that's just something that's important to remember. Okay, some different types of subsidies and rental assistance. There's all kinds of different programs and all kinds of different subsidies that'll go along with those. There's diversion or just short-term rental assistance. And that's usually for people that are either they're at risk of experiencing homelessness or currently experiencing homelessness, but it's a very like one-time or short solution. Maybe it's like this person's about to become evicted and they need to pay, $1,000 of back rent. Let's help them pay that so they don't get evicted, something like that. Rapid rehousing is also one-time or short-term, up to 18 months usually. This will often include case management and support services. And it's directed at people who are experiencing homelessness or imminently at risk that will be able to pay rent on their own at the end of the program. So usually folks with some kind of income. Transitional housing is usually 12 to 24 months, and that'll include case management and life skills and education, housing search assistance. And that's more directed at people who are experiencing homelessness and maybe need a little bit of time to stabilize or need to build some more skills. There's PSH, permanent supportive housing, which is long-term or permanent. So as long as the person wants to stay in the program, they're able to stay in the program and continue accessing that subsidy. It'll usually include more intensive services, more wraparound services. So maybe it's case management and peer support and clinical support. And that's for folks usually that are experiencing chronic homelessness or have other high risk factors. And long-term or permanent subsidies that are going to go along with that are going to help folks pay their rent ongoing. Usually, it might be a housing choice voucher, it might be a subsidized project-based housing or a housing tax credit, something like that. Those services are usually not provided by the subsidy provider. They're usually two separate entities that'll work together. And those are directed at folks who are low income and have other specific eligibility criteria, such as chronic homelessness or something to that effect.
I did drop a link into the chat. Anessa had mentioned earlier about a subsidy matrix that we have partnered with Department of Commerce to create, and our ALTSA partners at DSHS. It shows all the different state subsidies that exist across many of the different programs, who you access to get those, who's eligible for them. So please use that tool. It gets updated periodically. It does need, I think it's in the process of actually getting updated right now. And also, just to kind of, I don't know if we've mentioned the Transition Assistance Program, our TAP program.
That's the next slide.
Okay, I didn't know I wasn't sorry. And Apple Health and Homes, which is the new program that we're rolling out, partnering with Department of Commerce and DSHS as well, will kind of bring the three legs of the stool, as we like to say, together, where we're bringing bricks and mortar services and funding together. So there will be folks in supportive housing, enrolled in FCS supportive housing that will be eligible for Apple Health and Homes. And so please stay tuned for that, because that will be a long-term voucher. It'll be either a tenant-based voucher or a project-based voucher. So there'll be choice there down the road. So just be aware of that and stay tuned, because that'll be a great resource for many of the folks that you would be serving. Back to you, Vanessa.
It's a great segue into talking about TAP. TAP is so cool. It's only been around for about a year. It rolled out last year and it got spent up really fast because of how amazing it is. The max spending is about $5,000 per enrollee every year. Spending over $5,000 in a year must be approved by WellPoint via ETP. So it is possible to do more than $5,000 on a, as needed, as approved basis. It covers lots of things that other subsidies don't necessarily cost. It can pay for documentation like IDs, social security card. It can also pay for application fees, move-in fees. It can even do stuff like parking spaces or moving fees, like getting movers, storage units, things like that. And of course it can get like beds and household essentials, household items, furniture, things like that. But of course, because it is so cool and it's so flexible, it got used up very, very quickly. It was tapped out within 3 months. Unfortunately, it will renew on July 1st of this year, which is still a few months away. So we are really trying to encourage providers to braid it in with other funding as much as possible. I would not use TAP as like a first go-to for everything. If there's something else that can pay for something, maybe try and utilize that first so that this program lasts a little bit longer this year, this go around, fingers crossed. And again, it is a short-term resource. It's not an ongoing rental payment. Do you want to add anything more to that, Kimberly or Maureen, since you're on the call?
I don't need to add anything more to that. I don't think. I'm just excited that we have TAP. Just like Anessa said, it did go really fast this past year, which anytime we have a great resource in housing, we like to use it all up. But we are encouraging people to remind you of what you've had before TAP to use also, so that we are working to try to spread the funds, of course. But yeah, please stay tuned. TAP will be back around July 1. And you do have to be contracted to access TAP. If you're an FCS provider, it's a separate agreement that you make with WellPoint to be able to utilize the TAP fund. So just be aware of that. It is a side process that you connect with WellPoint to do. Thanks, Vanessa.
Thank you. Okay, back to the PSH principles. Housing integration. So this means we like to see folks in regular units in the community as often as that's possible. Of course, some folks will opt for like an agency operated program housing or a project building. That's totally fine too, but we really like to see when somebody's just in a regular apartment in the community, you wouldn't know that they're tied to any kind of PSH services or anything like that. So if they're set aside for if they're in units that are set aside for folks with disabilities, or they're in a big project building, that can ding agencies on fidelity. But again, there's a place for those too, so I'm not knocking it. But folks really benefit from being integrated in the community. When they are in those scattered site units, they're often able to, well, first, it usually gives them more of a choice in where they're living. So they can choose to be somewhere that's, closer to work and family and whatever else they may need to prioritize there. But if somebody's integrated into their community, of course, they're going to be more motivated to maintain their housing. They're going to be more invested in keeping it, leads to better outcomes. There's a few different kinds of housing interventions, like we talked a little bit about earlier. There's prevention programs that are directed at folks who are at risk of becoming homeless for a variety of reasons. Diversion programs to help people find safe alternative housing immediately rather than experiencing homelessness, having to go to a shelter, having to be unsheltered. There's emergency shelters, which are usually facility-based, night-by-night living arrangements that'll allow folks to enter and exit irregularly, just kind of as needed, on a night-by-night basis. There's rapid rehousing, which can provide short-term rental assistance and time-sensitive services. Transitional housing, which is a supportive but temporary type of accommodation that'll bridge the gap from homelessness to permanent housing. Folks don't necessarily have to utilize transitional housing. Some programs will kind of put transitional housing in place as a bridge, but it's not something that has to happen. It can be helpful for some folks. An example of transitional housing might be Oxford houses. And then there's permanent supportive housing, of course, which will integrate affordable rental housing with community-based support services like we talked about. Permanent housing is, of course, living in a building that is habitable, that you could live in long-term. And also some providers just do the support services, don't help with housing, and that's fine too. A lot of housing providers will partner with providers like that. Okay, so separation of housing and services is another important principle. Typically, low income or subsidized units come with case management attached, and that can create kind of a blurred line for separation of services, especially if the housing case management provider, if that same agency also owns their own buildings, that can be where it gets a little bit weird. So we like to see the housing provider and the housing case management team are completely separate. So for example, like a housing case manager would not ever be taking somebody's rent, wouldn't be posting notices, wouldn't be doing inspections unless maybe the participant asked to have them there as support. Basically, we don't want your housing case manager, who should be somebody that a participant is comfortable talking to about their housing barriers and, seeking support from. We don't want that person to be the same person that could potentially be in charge of evicting you. Another time that can get a little bit weird if the agency providing the case management services is also providing the housing is when there's an office in the building. So say downstairs is staff offices, the next floors are all apartments. That can be a little bit weird too, because that would mean that housing case management is gonna probably see more things going on than they would if their office was located somewhere else. You're seeing people, come in and out of their home. You're seeing lots of guests and, traffic and things like that. It might give you more information than you would otherwise have. So ideally, staff offices are away from where folks are living. Okay, and then flexible and voluntary services. So there should be ideally a menu of services for folks to choose from, which means they could have a clinician, or they could have peer support, they could have employment specialists, they could have housing specialist. Ideally, we like to see services provided by a team. Folks should be able to choose the location, duration, frequency of the kind of services they're receiving. So if they say, I want to meet with my housing specialist once a week, or I want to meet with my housing specialist once a month, both of those should be fine. A person should be able to change the frequency and intensity of their services if they want to, if maybe they need lots of support at first and then they're like, you know what, I'm fine for now. I'll call you when I need more help. That should be fine too. If folks are housed, they may or may not be comfortable meeting in their apartment. It should be fine to, have other options for them, like meet at the library, meet at a park, meet at the office, things like that. Services, like I talked a little bit about earlier, should be voluntary, in that if somebody opts not to participate in housing case management, that doesn't mean that they then lose their apartment. They should still get to keep their housing while not having to participate in services. And of course, services should be person-centered. They should be very much tailored to the person that you're serving, which means, every interaction with every different person is probably going to look a little bit different. Somebody might need help with their benefits, and somebody might need help with an ADA unit, and somebody might be housed already but needs to move because of a DV situation or something like that. With housing, there's always lots of different needs, lots of different situations. Services should always be very much customized to whoever you're working with. Ideally, the typical caseload size for service providers should be no more than 15. A lot of agencies have a hard time making that pencil, so, I mean, programs do what they have to do to make it work, but we like to see no more than 15, because if you have more than 15 people, as we know, if there's a lot of crises or folks just, we believe that you're going to be able to get a higher quality of case management if the service provider doesn't have 60 people on their caseload. And ideally, services are available 24/7, which means there is some kind of after hours or on call, or maybe staff kind of have staggered schedules where some folks are available on weekends or some folks work a little bit later or earlier in the day, just so that participants are able to get a hold of them anytime they might need them. Okay, so other resources and things to consider that we have, would definitely recommend getting on our distribution list. We have lots and lots of training announcements that go out all the time. We do a monthly housing topical on all kinds of different topics, from client choice to fair housing to all kinds of different topics. We also partner with some national TA agencies, such as Rutgers. Rutgers has done some really cool trainings for us, like working with folks with hoarding behaviors, and the Golden Thread. We did I think it was a 6-part Golden Thread series. That one was really cool. You can register for provider alerts. Kimberly, what else am I missing?
Yeah. Oh, I love
A lot of
research.
things.
My favorite part. So I did throw a bunch of resources into the chat throughout the presentation, but also we have, and I'll drop the links in for our Pathways to Housing website and our Pathways to Employment website. These are websites that we were able to create here at the state to really just resource folks that are either providing services to individuals or for individuals themselves that might be looking for different kinds of support and services. So please have those on your favorites. Check them out. They're super helpful. We have a lot of tools available to providers around housing and employment. And a lot of those are on those websites, as well as there is training modules where you can help onboard staff around housing and or employment. And so we want to make sure that folks are aware of those trainings. Like Anessa said, we do at least 5 webinars a month through our team and our national TA, as well as we have a YouTube channel for FCS that has all of our, I would say most of our past presentations that we've done if we were able to record them. And so you can access the FCS YouTube channel and get connected to all of the past webinars that we've done across about 5 years. I don't think we started that until 2019, but just know that there's lots of things out there for you all to get connected to. And of course, the FCS team is always happy to meet up with you and talk more about the services. We have the 4 trainers on hand that are happy to come out and do one-on-one or group presentations, whatever needs to happen to support the work that you're doing. This really was designed so that you had folks to walk alongside you as you implement FCS and beyond. And so please utilize the training staff, even if you just have that, you're in that contemplation stage, they can help you kind of walk through what that might look like for your agency, or what kind of programming or modeling you might want to create to bring FCS into the fold. So please don't hesitate to reach out to us. Our favorite part is working with the provider network. And so that's what we want you to do, is connect with us, and we'd be happy to keep you thinking about FCS if that's something you're looking into.
Right, and with that, what questions do we have?
I just really appreciate, I mean, I don't know if anyone, I hope everyone is paying attention. They're dropping partnerships that are just very organic, and it's so wonderful that they're happening now. They're saying things like Commerce, DSHS, all these partners have naturally come together to support this work. I highly recommend, if you are a provider or looking to be a provider, reach out to this team. They'll help you walk through it. If you're not really sure how that would be implemented in your community, ask. It's great to be equipped with as much knowledge as possible, especially when it comes to these types of supports for our community members, for our clients. And program grading is so important. Clearly, we see some programs run out of money very quickly because they're wonderful and they're working, but let's maximize the output and what we're getting. That was wonderful. Thank you both.
Thank you.
Yes, thank you, Kimberly and Nessa. I do have a quick question regarding the provider map, Nessa, that you showed in one of your first slides. How often does that map get updated, and is it up to date currently?
Oh, that's a great question. Kimberly, can you answer that one?
Yeah, so it is a little bit, there is a little bit of a lag in the update. It gets updated monthly. However, we're working to enhance and improve the map a little bit, just so you're aware. Part of it is that the map is going to show you who's contracted for FCS services. However, not everyone that's contracted is necessarily providing services currently. And so one of the things we're working on is to limit that down so that we know, so people aren't going to places that maybe are contracted to do employment but aren't actually doing employment services at this time. A lot of agencies do contract to do both benefits, but then start with one and then work their way to doing the other, or maybe they never get around to providing employment or housing. So just know that if you're really unsure about an agency that might be providing services, we can connect with WellPoint, who used to be Amerigroup, to find out if that agency is actually billing for services. So you're not sending somebody to an agency that may or may not be. The other thing about the provider map is there is on the far, when you go in there, there's icons next to the agency. It'll tell you if they're accepting referrals or not too. So some agencies don't take external referrals and some do. So you can look to see if somebody is actually accepting external referrals, as well if you're trying to connect somebody to an FCS agency. So
Awesome, thank you. And for Mike, the slide deck will be on the greaterhealthnow.org website here in a couple of days, along with the recording as well.
any other questions?
Sure, Maureen asked, so let's just beat all the questions. What is the typical onboarding process and length for an organization to become a provider? Is it just kind of dependent on their current structure, or what's the typical length?
Yeah, it does depend, because if you're already set up to bill Medicaid, it's a much shorter process than somebody that will have to get their MPI number and get into provider one and those kinds of things. I think I would say I don't know if I want to even speak to an actual timeline at this point, because I'm not positive on what it's looking like, but I can definitely talk to Rayanne, who actually works closely with providers that they're onboarding, and see what the average time is right now. I think it's like three months ish, I want to say, to 6, maybe, depending on where your Medicaid status is. And know that if you are a new provider, one of the best things we can do is connect you with Rayanne Orbaum on our team to really make sure you're going through the quick expedited process when you're working with provider one, and not going through the traditional process, because we do have some ways to quicken that process a little bit for our provider network.
What's the best way to, oh, go ahead.
I was going to say, we're happy to introduce you to WellPoint. So if you do decide you want to get connected to WellPoint at any time, our team is happy to do an introduction and connect you to them, so you're getting to the right folks. WellPoint does have a very specific FCS team that's separate from their MCO book of business. So you'll get assigned to a provider or a program manager through WellPoint that'll kind of get familiar with you and your agency, so they can help be your point person when you have questions.
Is there a statewide referral system? Like if we were going to refer a client in any community, can they just go through FCS website, or they have to go to their specific provider or local community?
That's a great question. So FCS was designed for kind of the no wrong door approach. So if you have somebody that they can refer themselves, there is, on that quick reference guide I put a link in the chat. There is a 1-800 number that you can call WellPoint, and they can say, hey, I want FCS services, and they'll screen them and then get them connected to an entity in their community that's taking referrals. A family member can do the same. Hey, I have somebody that needs these services. They can get someone connected that way. If somebody's getting services from a provider that's already doing FCS, they can get connected that way. And then, of course, there's community partners all over that will help get folks connected in their community. It will be that they do have to go through WellPoint, or an agency would have to do an authorization, send in an authorization, and then get that approved.
We'll keep this going all day. We'll just make this a radio interview. You had mentioned coordinated entry, so that someone has to go through the coordinated entry process to then be eligible for services, or you have to go through the screening. If you're a provider in the area, like if there's multiple providers in a county, but they're not the coordinated entry leads, do they have to go through the other organizations to go through coordinated entry then to get referred over to a different agency? Or is it just dependent on their own personal screening process through each organization?
Yeah, so you don't have to go through coordinated entry for FCS. We are a program
Okay.
that's outside of CE.
Got
One of the things we do know is that there are a lot of CEs that are screening for FCS at the front end of coordinated entry. That's to ensure that folks that may not, our folks on FCS don't always tend to prioritize at the top of the CE list. And so that allows folks to get connected to services and be served while they wait on coordinated entry. We do encourage folks to use CE. I know in some communities it's like, however, coordinated entry is going to get folks access to different resources, right? And it helps show the need in your community, which is really important because that's how you get funding. And so I always tell people, I know CE can be kind of a challenge in some communities. We know it can be understaffed, but we also say try to get people connected if they want to. Of course, there's lots of folks that choose not to, but we know that that's a good resource to get those subsidies and get connected to those things. So, but FCS is outside of the CE system.
Thank you, Kimberly. I'll
Yeah.
open up the floor so I don't hog it. I hope other people have questions.
Yeah, feel free to type them into the chat box as well. If you don't feel like unmuting yourself, you can always type it into the chat box.
That means we did our job today.
You guys did. It's always wonderful.
Lots of
to hear.
information, and whatever you didn't give us, you gave us a list of resources to follow.
Yeah.
We have more resources than we know what to do with. So please let us know if you have questions. I'm sure one of us has a resource to offer to you. That's, as a trainer, we've always wanted to make sure that everyone had what they needed to do this. And also, like, we all come from direct service doing this work. So we created tools and things that help that we wish we'd had when we were in direct service. And that's kind of the fun of the training positions. They get to do all the fun creation of tools and support for you all to be able to go out and spend time with your participants. So
I actually do have a question, if you don't mind, and apologies if this has already been addressed. But I work at Sundown in Ranch, and we are an inpatient SUD program that the average stay is typically 28 days. And our biggest challenge is that in 28 days, we have very little time to help get a patient started on the journey of finding housing and funding. We work closely with HARPS, we work with the HEN program, but all of those programs take quite a bit of time, the application process. So, patients essentially when they leave, they still are looking at a couple of more weeks or a month before that funding comes through. So our biggest challenge is finding resources that we can implement quickly, and that during that month period we are able to get all of our ducks in a row so that there are resources available once that patient graduates our program. I'm just curious if there's any thoughts or comments on that.
Well, I have lots of thoughts. No, that is the biggest challenge. In fact, last year we created a discharge planners toolkit because we know that a lot of folks in our state are exiting into homelessness from inpatient settings. And so I had the pleasure of helping build the toolkit to ensure that folks were getting connected to housing interventions as early as possible. The challenge with FCS is that because Medicaid gets suspended when folks are in inpatient settings for a period of time, we can't go in and do that early intervention until their Medicaid is reinstated. And so part of the work that we're doing right now, especially at the state hospitals, is we're going to have FCS folks up there to do kind of all the front work ahead of time so that when they step out that day and their Medicaid's reinstated, they can instantly already have a connection to an FCS entity to help them start the process of finding housing. I think HARPS is a great resource, and they are able to come in before because they don't require Medicaid. And so I think it's having those folks that can kind of do some of that front work to get them ready to go. So that day, and we do have some inpatient folks that do FCS, because that way they can be doing that work while they're working with individuals, right? Or get it ready to go so that they're able to. FCS is able to go into IMD settings, certain IMD settings, but the process has been a little challenging in trying to figure out how that works. So one of the things I talk about is having those partnerships in your community, which I'm sure you already do, that are doing some of this work. But I would say if you can connect with teams that are like peer bridgers or HARPS programs, where they can come in and kind of work with those folks before their Medicaid's reinstated, that is a way to get those interventions started. I'm going to drop the toolkit into the chat as well. It's not really designed for folks who live and breathe housing, because most of these resources. It was designed for folks that don't get trained in the housing system, and we like to make it super complex for you. You're welcome. Because we're always trying to fill a gap, right? And so sometimes we're adding layers to a giant onion already. And part of our work in FCS is to kind of help peel those away so you guys understand the system and try to make it less complex. But it's just the nature of housing in Washington, is there's just a lot of different things. But the toolkit does have a lot of resources connected to it to get people as quick to that specific provider in their community. So it asks a series of questions about their Medicaid, about their housing status, where they're going to go when they leave that inpatient setting. And then it uses an electronic decision tree to kind of determine what resources they could be eligible for based on the programming we've put in. And then it asks a series of additional questions to really hone in, like, what county are you going to? And it'll bring up what they're eligible for, what they may be eligible for, and what they're not in their county. It'll bring up those agencies that have those services. It's not a perfect system, and I wish I had a better answer for you, because I think that's a gap that we're struggling with. FCS is a great resource, but right now, because of the Medicaid situation, we just can't do that early intervention beforehand with the program. We can't go into your settings and provide those services. But we're working on it, and there's some stuff to stay tuned for. Okay, so just know that that's one of the, there might be some state funds coming down connected to FCS, and that's one of the populations that we're considering, is that gap of when someone leaves inpatient to when they can get to FCS. So we are talking about that internally right now.
Thank you.
Yeah, absolutely.
Thank you. The floor is open for any more questions that you guys might still have. And while we're still thinking of some questions, if you guys are still, kind of gathering your thoughts, trying to digest all of the information that, Kimberly and Anessa just shared with us. I do want to share that the recording and slide deck will be in the greaterhealthnow.org website under the resources section. You will find them there. And to tie it all together, for our next learning collaborative next month, March 28th, same time, 9 to 11 a.m. in the morning, we are planning on having more information on supported employment and supported housing. But this time we are planning on having hopefully providers from all of the 9 counties that we work in present their programs. Just, a quick, short, fast presentation with full of information that hopefully you guys will find useful. As well as we will try to get somebody from WellPoint to give their input on this program as well. So we're trying to wrap it all up for you guys in this nice little package, full of information that Kimberly and her team have been able to bring to us here to the Greater Columbia region. Any questions? And the floor is open. Comments as well. Feel free to share.
Yes, the package is getting bigger and bigger. The more we go, the more stuff. I'll just add one additional thing, since we're waiting if there's any questions and we have a little bit of time. There are new initiatives connected to FCS. If you joined Scott and I in our first presentation, we kind of talked about Apple Health and Homes. We also talked about the Glide Path program. I just want to bring that up. A lot of you said you work with HEN. So one of the things that we have just that started last year in a proviso was a program to bridge the HEN and FCS supported employment folks. So we were able to get some money to to provide folks through the HEN program, if there are individuals that are enrolled in our FCS supported employment program who are losing their HEN benefit due to increased income from going back to work or other eligibility criteria, they could be eligible for Glide Path, and HEN has up to 9 months of additional rental assistance for those folks in most counties. I can't say all because there were some counties that opted out of that money. And then on the healthcare authority side, we were able to contract with an agency in every region to provide additional benefit planning, as well as some support funds for those individuals so they can get reduce some barriers to going back to work. And so this is kind of to ensure that folks get a little bit more time in becoming self-sufficient. Of course, this is an opportunity to get people connected to supportive housing if they're not already receiving supportive housing. Maybe they're just getting that kind of low-key HEN case management. They need a little bit more intentional or intensive case management. And so this is a great way to bridge not only the employment housing world together, but also some of our partners that we know our folks are accessing, like HEN, but also building a good partnership bridge to work together more closely with more efficient referral processes, which is just more beneficial for the folks that we're serving. So that does exist out there now as well. And I think I have every region but Salish contracted for Glide Path. And so if you're interested in knowing who those folks are, I'm happy to give out a list of who our Glide Path partners are.
Awesome. Thank you, Kimberly. I see no questions in the chat box. I do see the links that you have been providing on there, Kimberly, so thank you for that. Any closing thoughts, Nicole, from your end?
Just that I appreciate you all so much. Have been worked in direct services and housing. This is so helpful that you're persevering and being so tenacious is the best way I can describe this. Is housing is so complicated, programs are so complicated, and there's so many gaps. So you know, 12 years is a long time, but not at all when it comes to this much change. So congratulations for making this much of an impact in a short amount of time and continuously fighting for housing and supports.
Thanks for having us. And we do have to be tenacious for housing. I think there's no other way.
Absolutely.
So we appreciate you having us today and bringing the FCS team together to offer these resources and this information. And again, if you guys sit on this a little bit and tomorrow or next week or a month from now, you think I need to know more about FCS or I want to get connected, please feel free to reach out. Yeah, we just want to help folks be able to get served well. We love FCS. We believe in it. We think it's a great program. And it's another wonderful resource out there to help serve our folks and braid together to make sure we're wrapping around individuals. So we just can't say enough about the provider network doing this great work. And we know that your job is really hard out there. And so we're trying to make it easier as much as we can from our side. So thanks, everyone.
Thank you, Kimberly and Anessa, again, for today's presentation. And if there's no more questions, then that concludes our learning collaborative for today. Thank you, everybody, for attending.
Thank you.